How do you diagnose low back pain? Low back pain can easily be diagnosed first from the history, how the patient presents, what may have resulted to these low back pain symptoms. If you've been straining, or if you've been involved in some form of trauma, be it from sports, be it from a road traffic accident, then that is helpful for any health practitioner or clinician to determine what is likely to be the cause of the low back pain. And then, of course, if it's traumatic, we shall require the help of radiological investigations, simply like an X-ray, which will help us to indicate or will show whether we have bony fractures, or fractures of the bones. We have prolapse of the discs, which we can be able to check on the X-ray. And if that is not helpful, then we require other specialized radiological investigations like magnetic resonance imaging or the MRI. We can do PET scans, so those ones can show us, the MRI will show us soft tissues like the nerves, nerve entrapment syndrome. We shall be able to pick those kind of small details on the soft tissues. Then we also have what we call as nerve conduction tests like electrocardiograms. We have nerve conduction tests which will help to show whether the nerves have been injured, because that will definitely be the main cause of low back pains which have been associated with trauma. Then of course, the treatment of low back pain is easy. It can be done from home, or when it's worse, then it can be followed up by a doctor. We have pharmacological and non-pharmacological treatment. I may need to demonstrate a few things on what we need to do when we have acute causes of low back pain without involving drugs or without seeing a doctor, just by relaxing the muscles of the back. So we have what we call as yoga, which I think is common to most of us. So yoga are simple exercises that are meant to stretch and relax the muscles of the back. Bed rest is also one of the recommended treatment or non-pharmacological care for the low back, but it shouldn't be for long, because that may also contribute to other conditions. For example, depression. We can have clots developing, what we call as deep venous thrombosis, and that can cause more danger than the low back. So bed rest for about 1 day, but with movement in between is also recommended. We also have what we call as physiotherapy. So we can have the chiropractor or simply any person who can be able to apply pressure on the low back